If you're very active and put your body through its paces, then it's possible you may have experienced a groin strain. So in this video, we identify some exercises that help you recover and reduce the likelihood of any further reoccurrences. Hi everyone, and welcome to Exercise for Health. I'm Richard, and today we're looking at exercises to prevent and recover from a groin strain injury. If you're new to this channel, we offer tips, advice and exercises to help you manage your health condition with physical activity. So go ahead and tap the subscribe button below and the bell icon if you want to be notified of when we upload a new video. So the groin muscles consist of three large muscle groups, these being the abdominal, iliopsoas and adductor muscle groups. In most cases, a groin strain is adductor related and primarily occurs when there is a sudden explosive change in direction, particularly with lateral movement and excessive forces through the hip joint. This can affect any of the 6 adductor muscles on the inner thigh and be classified as grade 1, which is mild, where there is no loss of function, but it can cause minor pain symptoms. Grade 2, which is moderate with intense pain and significant hip adduction weakness. And grade 3, which is severe and can also be a full muscle tear causing complete loss of function. If you've experienced a grade 1 or grade 2 strain and you've allowed around 72 hours for the body to begin the healing process in the initial acute phase of recovery, then you can begin stretching and strengthening the adductor muscles, providing it does not increase any pain symptoms. And this should be your barometer as to whether you can do more or should do less. Mild discomfort is okay, but pain should not be experienced in any of the following exercises. Initially, start with some gentle stretching and mobility for the adductor muscles. As an example, begin on all fours and take the foot of your affected leg out to the side until it's straight. Then gently start to move your hips backwards as though you're going to sit on the heel of your other foot and then return back to the start. Gently rocking backwards and forwards, feeling for any tight areas will help you begin to restore a range of movement back into the hip and adductor muscles. You can play around with some variations as you feel more comfortable, which can include leaning the torso towards the affected leg or rotating the hip in different positions to help isolate any tight spots. Another version is the frog stretch, where both knees are taken away from the midline, and while resting your elbows on the floor to support your weight, you can gently rock backwards and forwards, as well as tilting the pelvis forwards and backwards to improve the mobility. Yes, I know it looks very dodgy, but it is a great position to isolate the adductor muscle group. When these mobility exercises and stretches become comfortable, which may be after a week or two, you can start to strengthen the muscles with both isometric and dynamic resistance exercises. Always start with positions or movements that place less resistance through the muscle, using shorter levers or less weight, progressing up to longer levers or increased weight. As your groin strain recovers, you'll be able to progress the intensity of the exercises. A low intensity level exercise could be using a small squishy ball between the knees while lying on your back and applying some gentle but constant pressure to keep it there as though you're trying to pinch your knees together. For any isometric exercises where you contract the muscles but remain static, you should aim to hold the gentle contraction for about 30 to 60 seconds while breathing naturally. A dynamic version of this can be butterflies, where you start with your feet together and slowly allow your knees to drop out to the side, then use your adductors to lift the weight of your thighs back up together again. For any dynamic movements, you should aim to do a set of 10 to 15 reps, by which point you should feel the muscles working. You can also do sumo squats to help the adductors, where your knees and feet are kept at the same wide position throughout the movement. And although they don't isolate the adductors directly, like the previous 2 exercises, your body weight will provide an increased level of resistance for that muscle group. For mid-intensity level exercise, you can do some adductor leg raises. This will be lying on the side of your affected leg, so the bottom leg raises up through the midline of your body, contracting the adductor muscle group. Make sure you don't drop your top hip back, so you isolate the adductors of the working leg and not the hip flexors. To avoid this, keep the foot of the other leg on the floor in front of the working leg. An isometric exercise could be a modified version of the Copenhagen plank, where your knee of the affected leg is placed on a chair or bench and the contraction of the adductors will lift your hips off the floor. You can use the other knee to remain on the floor for support or take it off the floor for an increased load through the adductors. A Cossack squat or side lunge with or without added weight can really fire up those adductors without placing all the load through them and will begin to bring back some functional strength to the muscle group. Just make sure to keep the affected leg straight throughout the movement and only go as low as you feel comfortable. For high intensity level exercise that will be ideal to get back to sports where a high degree of hip stability as well as groin and core strength is required, then Adductor Flyes might be a good start point. Obviously this places a lot of stress on the adductors of both legs as well as challenging the surrounding tissues of the hips and core, so do be careful with this one. Keeping your legs straight with the hips flexed at 90 degrees, allow both legs to drop out to the side before returning them back to the start. The aim is to use the exercise for an increased range of movement, but be aware that the load will increase the wider you go, so don't overstretch and re-injure yourself. If needed, you can increase the load by adding ankle weights to the movement, or even isolate the injured side by only keeping the other foot on the floor. Alternatively, if you have a looped resistance band or access to a cable machine in a gym with an ankle strap attachment, you can use this additional resistance in a stand-in position, doing the same exercise but through a smaller range of movement. This also differs from the Adductor Flyes in the sense that the resistance increases when the legs are closed rather than wide open, making it a safer alternative. You can also make it more dynamic by stepping side to side, working against the resistance. To work isometrically, you can again do the Copenhagen plank, but this time using a longer lever, meaning your foot is on the chair or bench rather than a knee. This exercise has been shown to be very effective at reducing the likelihood of re-injuring the groin during sport participation. So if you are able to, in the late stage of rehab when you're considering returning to sport, this exercise is highly recommended. Finally, the single leg Romanian deadlift with the affected leg elevated out to the side can be a great way of increasing the adductor activation as well as improving the range of movement. Make sure you only hip hinge and drop as far as you can to engage a stretch of the adductor before returning to the start. I hope the information provided in this video has given you some helpful guidance for recovering from your groin strain injury. If so, then please give it a like by clicking the thumbs up button below to help this channel grow so more people can benefit from it. Thank you so much for watching, and remember to stay active, keep moving, and I'll see you next week. Thank you for watching. If you enjoyed this video today, please give it a thumbs up. You can also click here to subscribe to this channel or click here to watch a recent video. See you soon.